Welcome back. We'll start with a new topic, biomedical waste management. Here we will study about introduction, definition, history, aim of waste management, classification, sources of BHW, categories of BMW, and management of biohazardous waste, and the conclusion. So, medical and dental care is important in our life, and the medical waste will be emerged as an issue of concern. Nowadays, the medical waste is a problem because it is very difficult to destroy it or vanish it. It is problem for the community, man, as well as the for environment. So, what is biohazardous waste? According to WHO, any waste generated during the diagnosis, testing, treatment, research, or production of biological product for humans or animals. Okay. Any waste which is generated during the any type of diagnosis, testing, treatment of patient, research by the health people, and production of biological product like vaccines or anything for humans or animals, these are called the biohazardous waste. History. In the late 1980s, items such as used syringes washed up on several East Coast beaches, USA. HIV and HPV virus infection was causing because of this due to development of biomedical waste management law in USA. Okay, they were just washing and they were reusing the syringes. Because of this, there was a huge spread of HIV and HPV. So they started biomedical waste management. However, in India, the seriousness about the management came into light only after the 1990s. So, what are the aim of waste management? It is disinfection, a reduction in bulk volume, making surgical waste unrecognizable, condition of dangerous recyclable items unusable. What are the health waste categorization? Hospital waste is further divided into non-hazardous and hazardous. Again, hazardous divided into infectious and other. Others comes in radioactive and cytotoxic waste. So WHO estimates that 80% of the hospital waste is non-hazardous, but 15% is infectious and 5% is hazardous from other sources. So what are the classification of healthcare waste? Healthcare waste is divided into infectious and pathological. In the infectious, it comes as lab cultures, waste from isolation wards, tissues, materials and equipments of infected patients, excreta and human tissues or fluids. So these are very infectious. And the pathological, the human tissues, fluids, body parts, blood or body fluids. These are the pathological waste. What are the sources? Major sources are hospital, labs, research center, blood banks, nursing homes and mortuaries. But the minor sources of BMW is clinics, dental clinics, home care, paramedics, funeral services and institutions. And this is the very important, that is categories of biomedical waste. There are 10 categories. The first category is human anatomical waste, which contain human tissues or organs and body parts. This can be treated by incineration or deep burial. Category 2, animal waste, that comes as animal tissues, organs and body part. This is also treated by incineration or deep burial. And category 3, microbiology and biotechnology waste. Waste from laboratory cultures comes under this. This can be treated by incineration. In category 4, waste sharps, that is needles, syringes, calves, blades and glass, etc. This will be disinfected. Okay, you can't incinerate, so you are disinfecting it. Category 5, discarded medicines and cytotoxic drug waste. Again, you will incinerate it. Category 6, soiled waste, items contained with blood, contaminated with blood. This will be incinerated and autoclaved. First you will autoclave, then you will incinerate it sometime. Category 7, solid waste generated from disposable items, disinfection by chemical treatment. Category 8, liquid waste generated from laboratory, you will discharge it into drains. Okay. Category 9, incineration ash, that is ash from incineration of any biomedical waste, you will dispose it in a municipal landfill. Category 10, It's a chemical waste used in the disinfection. You will discharge into the drains. So how we will manage the biohazardous waste? Waste management is the collection, transport, and processing, recycling, or disposal of waste material. Okay, these certain agencies will take care of this process, that is waste management. They will collect, transport, process, recycle, or dispose the waste material. Term usually relates to material produced by human activity and is generally undertaken to reduce effect on health, the environment, and aesthetic. Okay, this is the program or a process or a activity which is done by a certain agency to decrease the effect on health and environment and the aesthetics. What are the color coding of waste disposal? Yellow, red, blue, and black buckets. In the yellow bags, you will put infectious waste, bandages, gauze, cotton, or any other objects in contact with body fluid, human body parts, and placenta, etc. In the red bag, you will put plastic waste such as catheters, catheters, injection, syringes, tubings, and IV bottles. In the blue bag, you will put all types of glass bottles and the broken glasses, articles, outdated and discarded medicines. And in black body, or black bags, again it's also called as black carbide, you will put needles without syringes, blades, sharps, and all metal articles. Sometimes you will use black for the general waste and white for the sharps. So, for the conclusion, safe and effective management of biomedical waste is not only a legal necessary but also a social responsibility. It should be a responsibility of every citizen of the country. Biomedical waste management cannot be successfully implemented without the willingness, devotion, self-motivation, cooperation, and participation of all sections of employees of any healthcare establishment. Okay, there should be cooperation and coordination between all the people who are working in the healthcare department. If we want to protect our environment and health of the community, we must see ourselves to this important issue not only in the interest of health managers but also in the interest of the community. So there will be transfer of infection or certain problems arises because of negligence during the biomedical waste management. So if we take care of these things, generally by the community also and by the health department also, we can prevent those accidents. So that's what about the biomedical waste management. We'll see in next class. Thank you.